Good morning and good afternoon, distinguished ladies and gentlemen. I'm Florie Lazier, President and CEO of the Corporate Council on Africa, CCA, the leading U.S. business association focused solely on connecting business interests in Africa. I want to thank each of you for joining us today for the official launch of CCA's U.S. Africa Health, Security, and Resilience Initiative. As we have all seen this year, the COVID-19 pandemic has amplified the importance of ensuring that healthcare is adequately funded and that countries have the resources to provide access to basic and essential health services and medical products. It has underscored the need to leverage innovation and strategic partnerships to deliver just-in-time solutions to health threats globally. It is now clear that to effectively strengthen global health security and build resilience on the continent, there needs to be more collaboration, connectivity, and deliberate information exchange across countries and regions, as well as between the public and private sectors. CCA's U.S. Africa Health Security and Resilience Initiative will serve as a platform that fosters linkages, information exchange, and collaboration to drive investment and trade crucial to the development of Africa's health systems. The initiative is centered around three focus areas that have been identified as critical pillars to strengthening Africa's health security, which are universal health coverage implementation in the region, disease response and management preparedness, and increased trade and investment in Africa's health sector. With that, we will now show a very brief video about the initiative and its key objectives. So today's program will set the stage for the work we will do through this initiative. We're so excited. I'd like to express my gratitude and give special recognition to the initiative's seed funder, Pfizer. Your support shows how committed you are to CCA and to strengthening and advancing Africa's health systems, as well as commercial ties between the United States and Africa. I would also like to acknowledge and thank Gilead Sciences and Medland Health Services for their sponsorship of the initiative, as well as CCA's health sector members for their contributions to its development. Let me also thank Dr. Jeffrey Sturchio, CEO Raven Martin and CCA Board Chair, and Angela Wasuna, Vice President, Global Policy, Emerging Markets for Pfizer, for both agreeing to serve as the co-chairs of CCA's U.S. Africa Health Security and Resilience Initiative Task Force. We look forward to hearing all the U.S. and African government and multilateral leaders, as well as private sector executives who will be on the expert panel following opening remarks today. They will be sharing their lessons learned from the COVID-19 pandemic thus far and provide insights on steps they are taking to contribute to enhance healthcare financing and strengthening service delivery for improved disease response and management preparedness, implementation of universal health coverage, and increased trade and investment in Africa's health sector. With that, I am delighted to introduce Caroline Roan, President of the Pfizer Foundation and Vice President of Global Health and Patient Access at Pfizer, Inc. Caroline oversees Pfizer's Global Health and Patient Access function, including the design of social investment strategies that drive access to quality healthcare, medicines, and vaccines for the most vulnerable populations, stakeholder engagement, and public reporting on environmental, social, and governance issues. Under Caroline's leadership, Pfizer's Global Health and Patient Access portfolio developed a coordinated approach to strategic philanthropy and responsible investment, which uses the full scope of the company's resources to broaden access to medicines and strengthen healthcare delivery for underserved people around the world. So without further ado, I'd like to turn it over to Caroline.
Thank you so much, Flory, for your kind introduction. We're really appreciate the opportunity just to make a few opening comments because I know everyone wants to get to the panel. It's such an esteemed panel, and I think you'll learn so much from the discussion today. First and foremost, we are proud to be a key sponsor of CCA's U.S. Africa Health Security and Resilience Initiative. You know, COVID-19 has certainly brought into sharp focus the need for deepened collaboration and investment in public health. And we know that the private sector has a key role to play in this. And we look forward, as we always do, to working with governments, NGOs, healthcare professionals, and most importantly, patients to strengthen public health initiatives in Africa and beyond. So I want to take just a few minutes to talk about Pfizer's COVID-19 response efforts and then a few of the key takeaways and learnings that we've had. And then I'll turn it back over to the panel. So at Pfizer, we have been public about a 5-point plan that we issued in March to help fight the COVID-19 pandemic, including more than a $1 billion commitment of our own resources to develop a vaccine candidate without government funding. And we're very pleased that this vaccine has now received emergency use authorization from the US and the UK, and perhaps others. Things are very dynamic these days, but we have also started the next phase of response, which most importantly is vaccination, and we're really thrilled about that. We remain committed to equitable access for this vaccine and are working with several organizations to determine approaches for the global community. But at the start of this pandemic, we also knew that our communities were under so much stress and had immediate needs that needed to be addressed. And first and foremost, we knew that we had to ensure that our supply chain was working, that our essential health services were able to be provided. And for that, of course, for us, was ensuring that our medicines and our vaccines were making it to the hospitals and the clinics that needed them, for routine immunization, family planning, anti-infectives, and oncology medicines, even during this pandemic. And from a philanthropic perspective, we were able to leverage our existing commitment from the company to fight infectious disease, as well as our robust partner network to respond to the immediate needs on the ground. So as the company and the Pfizer Foundation came together, we were able to mobilize and deploy more than $40 million focused on supporting emergency response efforts, while also strengthening healthcare infrastructure to support underserved and vulnerable communities. Whether that is in the US to support infectious disease care in social safety net clinics, or working with partners like the International Rescue Committee focused on the immediate needs of refugees and displaced populations, we wanted to be a part of the solution. A significant portion of that funding, of course, was directed to our partners in Africa to ensure their ability to continue to do their work. Our lives to global public health, we know that unfortunately we weren't ready for COVID-19, not at the global, regional, or national level. The pandemic has underscored the importance of investing in infectious disease prevention and control, public health surveillance, and pandemic preparedness, and placed a renewed focus on the global discussion to create resilient, equitable health systems. Both the crisis and the response have been tremendous, and we should take forward the learnings to make effective new practices permanent. And I think this is key, and I'm sure you'll learn more about this from our panel participants. This realize the adoption of new technologies and really innovative approaches, including telemedicine, and demonstrated opportunities for new delivery models, including community-based delivery of care. Further, it has underscored both the need and opportunities for more comprehensive and connected responses at the government level. As a result of COVID-19, we expect those traditional silos between government's health and finance functions to break down, and we believe that health ministers will become ever more influential figures in the near term. This presents an opportunity for this new initiative to drive conversations about the budget benefits of investing in health with policymakers in key African markets. At the same time, unfortunately, the economic fallout from COVID-19 puts all governments and their budgets under significant pressure and will limit the ability of government's ability to invest in universal healthcare coverage. But we also know that governments can fill that gap through the adoption and uptake of commercial health insurance. And that's certainly something that this initiative can help to foster. We believe telehealth will remain a critical care delivery platform in Africa and globally. However, it is unlikely to meet its full potential without support from policymakers to ensure the pandemic-driven policies are made permanent and issues like data sharing are addressed. Now, COVID-19, of course, amplified existing health worker shortages around the globe and also in Africa. And we know that we will need to, in response to that, the governments have done creative things to expand the scope of non-physician healthcare providers like nurses and pharmacists and community healthcare workers. And we need to make sure that that is also made permanent. We expect this trend to continue post-pandemic, and we want to also make sure that continuing education is made available for these critical players in healthcare delivery. In Africa specifically, we've seen the African Union, of course, and the African CDC, as well as the African Development Bank and others emerge as critical responders to this crisis. And going forward, it will be vital that the private sector collaborates closely with these institutions and supports the implementation of the African Continental Free Trade Area to enable widespread delivery of goods and services, including those that are healthcare related, and the continued harmonization of regulations. Please know how proud Pfizer is to support this discussion today. The high level of enthusiasm that this event has garnered is evidence that we have a lot of passionate and motivated players from across a wide spectrum of industries who bring ideas, experience, and solutions to the table. With that, Flory, I will turn it back over to you, and I really look forward to this discussion. Thank you so much.
Thanks, Caroline, for your insightful remarks. And now it is my pleasure to introduce our first keynote speaker, Dr. John Nkengasong, who is the director of the Africa Centers for Disease Control. Dr. Nkengasong is the first director of the Africa CDC. He is a leading virologist with nearly 30 years of work experience in public health. Prior to his appointment with the Africa CDC, he was the acting deputy principal director of the Center for Global Health at the United States Centers for Disease Control and Prevention, an associate director of laboratory science and chief of the International Laboratory Branch at the Division of Global HIV/AIDS and Tuberculosis. Earlier this year, Dr. Nkengasong was appointed as one of the World Health Organization Director General's special envoys on COVID-19 preparedness and response. Without further ado, please welcome Dr. John Nkengasong for his remarks.
Greetings from Addis Ababa and greetings from the Africa Centers for Disease Control and Prevention, which is a specialized technical institution of the African Union. As you are all aware, the Africa Centers for Disease Control and Prevention, commonly called the Africa CDC, was launched on the 31st of January 2017 at the silence of the Head of State Summit in Addis Ababa, just after the devastating Ebola crisis that we all witnessed in horror in West Africa. I start at this point because it demonstrates the health security of the continent, how our continent, a continent of 1.2 billion people, was challenged between 2014 and 2016 to deal with a serious health security matter, that is the Ebola outbreak. Today, just a few years after, we are dealing with the COVID-19 pandemic, which is another health security challenge of a greater dimension than what we saw from Ebola. For the past 11 months, we have been dealing with the COVID-19 as a continent. It has been challenging. It has been an uphill task, an unprecedented crisis that we all know was predictable. We have seen warning signs from the Ebola outbreak in West Africa, warning signs from the multiple Ebola outbreaks in the Democratic Republic of Congo and others. Today, the COVID-19 in the last 11 months or so have taught us a couple of lessons in the area of health security, specifically in Africa. First, it has taught us that we are more connected than we thought we were, that we are more vulnerable than we thought we were, and that there are more inequities than we thought they existed. Going forward as a continent, we are taking health security seriously. And this requires that we really step back and have a courageous, bold, and uncomfortable discussion that will hinge around a couple of things. First is the continent's ability to produce diagnostics. Second is the continent's ability to produce therapeutics. And thirdly, the continent's ability to produce vaccines. To achieve all of this, we require that we also invest in a competent workforce that will enable and create also opportunities for our young researchers to work in centers of excellence that will guide the development of all three elements that are indicated above, i.e. diagnostics, therapeutics, and vaccines. Without a competent workforce, the continent will not advance those three key areas of health security. The governments of our countries cannot do it alone, and that is where, in the spirit of a new public health order that the Africa CDC is promoting, we are calling on strong partnerships with the private sector, strong partnership with the philanthropic sector, and strong partnership with bilateral and multilateral. But partnerships that are trusting, partnership that says that we are here to support the continental mission and vision and aspirations, and partnership that speaks to unifying and rallying behind a unity of purpose that the continent will put forward. And this is why some elements or key elements of this meeting are so important to us. How does the private sector invest and work together with governments to promote diagnostics development and as a continent both as a security issue, but also as an economic empowering element or dimension for the continent, as well as the diagnostics and vaccines development. Today, the discussion that is everywhere is Africa going to have access to vaccines against COVID-19? We should learn from this lesson and say that we cannot mortgage the future of our health security to externalities from outside of the continent. We should be able, when the next pandemic hit, to say that we were able to conduct research on the continent. Immediately we know the sequences of this threat or virus, to develop our own diagnostics, to develop our own vaccines, and to get immediately into clinical trials for drugs. That is what I mean by Africa ensuring the health security of its people, which has now become an economic security threat as well for the continent. I thank you all for the opportunity, and Africa CDC is looking forward to working closely with the Corporate Council in Africa to achieve this important initiative.
Thank you so much, Dr. Nkengasong. That was excellent in terms of sharing with us your insights. Now I would like to introduce Dr. Ngozi Okonjo-Iweala, the board chair of Gavi, the Vaccine Alliance, and also whom we all expect to soon be Director General of the World Trade Organization. A development economist and former finance minister of Nigeria, Dr. Ngozi Okonjo-Iweala has been the board chair of Gavi since January of 2016. Dr. Okonjo-Iweala brings more than 30 years of development and financial expertise to the Gavi board. She has served as Nigeria's finance minister twice, most recently between 2011 and 2015. Dr. Okonjo-Iweala was named by Forbes Africa as one of Africa's 50 most powerful women in 2020. She was named by Fortune magazine as one of the world's 50 greatest leaders in 2015, and by Forbes as one of the world's 100 most powerful women for 5 consecutive years. Although Dr. Okonjo-Iweala could not be here in person, she sent in a video of her remarks, which we will play. She has a Gavi board meeting today and very much wanted to be here, but she sent her video and we very much appreciate that.
Thank you, Flory, for inviting me to join you all today. We are now 9 months into this pandemic, and if there's one lesson we should take from this crisis, it is that the outbreaks of infectious disease are not just a threat to global health security, they're a threat to the global economy. The impact of this pandemic has gone well beyond the 1.5 million people who have tragically lost their lives and the 64 million people who have been infected. It has also had a devastating impact on people's livelihoods, on commerce, trade, and travel, costing the global economy more than $500 billion every month. Nowhere has this been more apparent than in Africa, where 52,000 people have lost their lives and 2.23 million have been infected. Worse still, the continent has lost more than a decade of development, while almost 30 million more people have fallen into poverty. The Lancet Global Health Journal estimates that the response alone is costing $52 billion every 2 weeks. With high levels of debt and debt service, many countries have limited fiscal space to respond. If allowed to continue, there are very real risks of civil unrest, disorder, and violence erupting, even in the most stable democracies, because of unemployment and economic hardship. The message is clear. The threat of COVID-19 is not just about global health. It's about global security. With the first COVID-19 vaccines rolled out last week, there is now hope that we can bring this crisis to a close, but we're not there yet. We will not reach the beginning of the end of the pandemic until these vaccines are made available to people in all countries, regardless of their wealth. Because the nature of the virus is such that no one is safe until everyone is safe. Thanks to COVAX, part of the Access to COVID Tools Accelerator, or ACT-A, we now have an exit strategy. Coordinated by Gavi, CEPI, and WHO, COVAX is the only truly global solution because it's the only one to ensure that people in all countries get rapid, fair, and equitable access to COVID-19 vaccines. With 189 governments and economies involved, representing around 90% of the global population, COVAX has the initial aim of making 2 billion doses of vaccines available by the end of 2021. Nearly half of these, just under 1 billion doses, will go to the 92 low and middle income countries that would otherwise be unable to afford them, of which 46 are African countries. But COVAX will only succeed if everyone plays their part. We need all vaccine manufacturers to make their COVID vaccines affordable, appropriate for global rollout, and available to COVAX for timely delivery as early as possible in 2021. And we need donor governments to ensure that COVAX gets the funding it needs. We have the US $2 billion needed to kickstart things in 2020, and we are most grateful to the international community for its support in making this happen. But we will only succeed in bringing this crisis to an end if we can get another $5 billion in early 2021 for the COVAX Advanced Market Commitment, or AMC, the financial mechanism created to secure the doses COVAX needs for the world's poorest countries. Similarly, we need beneficiary countries to play their part. Having vaccines available is one thing. Distributing them successfully is quite another. In this regard, countries need to prepare carefully to ensure their health systems are ready and fit for purpose to distribute the vaccines. African countries need to work with the COVAX facility and the Africa CDC to ensure that, first, any vaccines they distribute and administer to their population are certified safe and effective by the WHO. Second, that affordability is kept in view through systematizing demand and aiming for bulk procurement through the COVAX facility. With COVID vaccines beginning to be made available, demand will be high. Third, maximum efforts should be made to finance vaccines through grant and or concessional resources from multilateral development banks and other financial institutions. This is to avoid incurring additional debt for vaccination programs. In summary, ladies and gentlemen, every stakeholder has a role to play to ensure that this pandemic is brought to an end. We must all work towards a common goal because it is that kind of solidarity that will bring an end to the global crisis and enable Africa to build back better, restore social and economic stability, and ultimately make the continent more resilient to future threats.
Well, thank you to Dr. Ngozi Okonjo-Iweala and Dr. John Nkengasong for your keynote remarks. Let us now turn to Dr. Jeffrey Sturchio, who will be moderating our expert panel. We are so looking forward to this discussion of the key issues. Dr. Sturchio is the chair of the board and also a health expert, and so we're so pleased that he's here today and will be moderating the panel. Thank you, Jeff. Over to you.
Who's watching online. We really appreciate you taking the time and giving us your attention. I wanted to start just by saying a word or two of introduction. And actually, Dr. Nkengasong and Dr. Okonjo-Iweala have done a good job of laying out the issues that we want to discuss further in this panel, along with Caroline Roan. So I'll just make this short. Even though the COVID pandemic has hit the African continent not quite as acutely as it has the United States and some other developed countries, it's clear, as our previous speakers have shown us, that COVID-19 has disrupted the African economy significantly. It's going to be roughly a 3% contraction in 2020, according to both the World Bank and the IMF. This is really the first recession in Africa in close to 25 years. We're going to see GDP per capita at the end of next year, probably back to the levels before the great financial crisis back in 2008. And the road to recovery is going to be steep and uncertain. At the same time, it's going to require investments in inclusive growth. And one of the guarantees of how successful those investments can be is to also address the challenge of health resilience on the continent, because health and the economy are inextricably interwoven, as Dr. Akanjo-Iweala just told us. So achieving health resilience is going to take investments that will help us to improve effectiveness in a crisis, to maintain core functions of health when the crisis hits, and also to be able to adjust conditions as conditions require it during the crisis by learning from what has gone on before. And a resilient health system will improve performance both in good times and in bad. And that's going to be critical for recovering from the COVID pandemic and the other strains on African economies and health systems. We're going to need strong multi-sectoral partnerships to build sustainable solutions. And that is something that everybody has already alluded to. In fact, at the CCA Leadership Forum a few months ago, Dr. Zufak, who's the chief economist for the Africa region at the World Bank, observed that what we need to do is work together to protect Africa's future. And that's where this CCA Health Security and Resilience Initiative comes in, because we are hoping through the work we do on universal health coverage implementation, on pandemic response and preparedness, and infectious disease response more generally, and also on helping to strengthen the health sector through U.S.-Africa trade and investment. We hope that we'll be able to help protect Africa's future, in that evocative phrase, by linking economic recovery and health resilience and developing the strong partnerships that can deliver novel and sustainable solutions. So I'm looking forward to our discussion now over the next hour. And I'm pleased to have a really distinguished panel to talk through these issues with us. Let me just introduce them briefly, and meanwhile, the moderators will bring them onto the screen. We have with us today, and their bios are available to you on the website for today's webinar. And they include the Deputy Minister of Health from the Republic of South Africa, Dr. Matume Joseph Fahala. Also, Thokozile Rizvitso, who's the Director of Gender, Poverty, and Social Policy Division of the United Nations Economic Commission for Africa, which is based in Addis. Third, we have Nafisa Jawani, who's the Managing Director of the U.S. International Development Finance Corporation. We have Dr. Mohammed El Sahili, who's the CEO of Medland Health Services in Zambia. Dr. Papa Salif Sow, the Vice President of Program Development and Management, Global Patient Solutions from Gilead Sciences. And finally, last but not least, Lauren Hendricks, who's the CEO of the Equity Group Foundation International. And I'm really pleased that she's with us because her expertise is in financial inclusion. So we'll also talk about that. As I said, there's more information about each of them in the bios on the website. And let's get started in our discussion today by, let me ask the Deputy Minister a question. You know, as I just said, and as you've heard from the earlier contributions from Caroline Roan and John Nkengasong and Ngozi Okonjo-Iweala, health resilience and economic recovery are inextricably interconnected. This basic understanding is more important than ever, given the experience we've had this year with the coronavirus pandemic. So how are governments like South Africa thinking of how you can address business as unusual, since we have to start with new ideas and new programs, to get us back to something like a new normal? So tell us how you're thinking about this in South Africa.
Well, thank you very much, moderator, for the opportunity. Good morning, good afternoon. We are indeed very pleased to have been invited to take part. Indeed, just to say, as the previous speakers have indicated, while we can say that the African continent has not been as hard hit as Europe and the Americas, but in the context of the African continent, South Africa has been quite hard hit, with the figures which have been mentioned. Out of just under 2 million infections, close to 1 million of that is from South Africa. We are now approaching 900,000 infections, and with just around 23,000 deaths all in all. So both our health and also the economy has been quite hard hit. And also adding to that, just looking at those numbers, adding to the fact that quite early in the pandemic, around towards the end of March, early April, our cabinet declared a hard lockdown, in which economic activity virtually ceased, and also social activity. So that was the opportunity to try and build capacity in the health, so that our health facilities don't get overwhelmed, but at the same time hit very hard on the economy. Over the last 5 months or so, from around August, the focus has been to try and more balance, because we've always said that it's a balance between saving lives and saving livelihoods. And so the earlier period was more focused on saving lives, and we have increasingly, with a kind of a negotiated kind of approach, staggered approach, we have now leaned more towards saving livelihoods, trying to get economic activity, the president coming up with the economic recovery plan. So it's been a balanced act of saying, for us to be able to recover from this, we need to strengthen the capacity of our health services, infrastructure, equipment, commodities, human resources, technology in terms of information system, data gathering, but at the same time moving more and more towards saving jobs. So, and we're saying also to the leaders of business that this is an issue which is for all of us, all of government, all of society. And we're saying also in business, because now, while we had a reduction, there is an early resurgence already. So just yesterday, our president again had to address the nation to indicate that we're going to have to impose some further restrictions from those which has been lifted, because we are going now into a festive period of Christmas, but at the same time trying to save some business, especially your tourism, your hospitality. And the message basically is that all of society we are going into a new normal. This is going to be the new normal, both for society and also for business, that business can behave in the same way as it has been before. So in brief, I would say that that's really the overall message which our leadership has been giving out to the rest of our society. Thank you very much.
No, well, thank you for those first insights on what's happening in South Africa. Can I just to ask a follow-up question? You mentioned that the president in the economic recovery plan is also turning to business to do its part. And one of the themes of our conversation this morning is about both how the U.S. and Africa can work together, and it's both private and public contributions to coming up with sustainable solutions. So could you say a little bit more about how the South African business community has responded to the needs to deal with the COVID pandemic?
Well, business has responded quite well. Just to give you an example, quite early on, around April, in fact, when the lockdown, just end of March, early April, the president announced the formation of a solidarity fund, which was a fund established in which everybody was invited to contribute. And a number of big and small businesses really came to the party. Some of them, I know some big businesses which contributed quite a number of millions of rands. I know a few of big ones which brought in each one about R1 billion into the Solidarity Fund. So that actually has helped us to be able to address issues in terms of procurement of various essential goods for health. For instance, a number of ventilators were bought from the Solidarity Fund. A number of PPEs were brought from that Solidarity Fund. The fund also provided relief funds for distressed families, adding on to the social relief which the state was providing. But also in terms of going forward, business has also been quite cooperative in terms of understanding the fact that, for instance, in the retail sector, in all the areas where, mining sector, to say that all of business must also play their role. As, for instance, business was opening, the message was very clear that you need to put in place preventative measures. Make sure that in terms of testing, as for instance, when the business was reopening and going on, to say all the protective measures in terms of keeping the numbers small, social distancing, providing sanitary facilities, washing of hands, sanitizing hands, and all those kind of equipments, that the workplaces must be different. So the message has been quite clear. And most of business, including, for instance, at retail sector, every kind of retail shops where you go to, you would find that there are people at the entrances who are taking temperatures and making sure that people are wearing masks, making sure that there are hand sanitizers. So all these measures have been observed by most of business. But going forward, what we're also saying is that there's going to be, as some businesses have suffered, so there's going to be also opening up new opportunities in terms of manufacturing of PPEs, ventilators, medical equipment, and so on, that as we do so, we must make sure that young people who are unemployed come in, women who have been marginalized, and all this, that it's going to be key that the economy can't be the pre-COVID and the post-COVID economy should be different. Thank you very much.
No, thank you. Well, that gets us off to a good start. And we've seen how South Africa has had this sort of whole of society response to the pandemic that our earlier speakers were talking about as well. Let's pull the lens back a little and now look at this from a continental-wide perspective. And if I could ask Thokozile, from what has UNECA been doing to work with your partners to address business as unusual to get us to a new normal? How does this look from your perspective?
Thank you, Jeff. It is indeed going to be business as unusual. But before I answer your question, I think we need to recognize a few things, and some of it both the minister and the other speakers did allude to. In essence, the health and economic crisis arising from COVID-19 has done three things in Africa. One, and you did speak to the economic downturn, it has accelerated trends already underway. Africa's overall GDP growth had already slowed down by 3.2% in 2019. Oil and non-oil commodity prices were already declining. And unlike elsewhere, Africa's absolute poverty numbers were increasing since 1990. And I think it's critical that we note, because COVID-19 has an effect on the poverty, on the increase of poverty on the continent. Then two, it has exposed existing vulnerabilities in the system that risks amplifying the effects of the crisis. For example, the low public spending on healthcare increases out-of-pocket expenditure on health, and thus limiting the access of public health care, particularly in the large proportion of involuntary, informal workers who are mostly without any social protection. This group is likely to slip further into poverty with the economic downturn caused by COVID. And in addition, and the minister did speak to that, the significant gender inequalities will be further exacerbated. These 3 points, therefore, emphasize the need of building resilience of the health infrastructure against future shocks. Therefore, in particular, what do we need to do better at the continental level? One, increased use of digital technology. It's so critical and crucial, especially telemedicine, because it will enhance access to healthcare. Two, increase access to affordable and quality medicines through, for example, the Africa Medical Supply Platform, which was initiated during the during the start of the COVID-19 pandemic, and it brought together the private sector, ECA, Afrexim Bank, the African Union, Africa CDC, which John spoke to, which is a critical platform for access to affordable as well as easy movement of supplies and drugs across the continent. Then three, a strengthened, suitable governance structure, such as the Africa Medicine Agency, AMA, which the African Union set up, for it to provide better regulation and management of quality and counterfeit drugs that make their way into Africa, which need to be managed. And the minister did speak to the importance of access to affordable medical supplies, and actually coming together with the private sector to be able to provide that. So AMA should be able to provide that. It's a structure that already exists that needs to be implemented and facilitated to make things happen on the continent. And then, of course, a competent workforce. John spoke about that, spoke to that point effectively, and I want to re-echo it. And this calls for training and capacity building across the different countries on the continent. So I see, Jeff, those as critical points at the continental level if we are to respond and as well as build better on the continent.
Well, thanks so much. Thanks so much for those examples. And it's, as you said, what COVID-19 has done is accelerate trends that were already there. And some of the examples you gave us are also examples of how the epidemic has encouraged or catalyzed the acceleration of positive trends. For instance, as you and others on this webinar know, there's been an effort to harmonize medical regulation on the continent for many years. And the African Medicines Agency is the culmination of that trend. And it was really catalyzed by the need to respond immediately to the pressures that the COVID pandemic brought. So that's a good example. And, the African Medical Supplies Program, platform rather, was also developed, within the framework of the AU and the African CDC, as you said. It was developed essentially in policy terms almost overnight through collaboration between all of those partners and the private sector. And it's had a really important impact during the year. So let me turn next to Nafisa Jawani. And Nafisa, it's good to see you, and thank you for joining us. Let me look at a different aspect of the kind of cooperation that both the minister and Thokozile have talked about, and that is from your perspective at the Development Finance Corporation, which is a development, as the name suggests, a development finance agency like others around the world. What kinds of programs have you been able to put in place using the core capabilities and competencies of your organization to help African countries to ensure the delivery of basic health services, to begin to think about the kind of manufacturing response and supply chain responses that our previous speakers have shown? How are you engaging in business as unusual to get to a new normal?
Jeff, thank you so much, and what a pleasure to and an honor to be on the panel today with everyone else. It's interesting. Health was a priority for DFC even before the pandemic, and as we were thinking about what are the areas in which DFC can really play a significant role, a lot of what we were thinking about was really around bolstering health system resiliency, focused on non-communicable diseases. And so, are there ways for us to use our investment tools around debt financing, equity financing, to support private investments that are looking at, dialysis centers, for example, or projects that are focused on oncology efforts to really bolster health system resiliency. When the pandemic hit, it really provided DFC with an opportunity to pause and say, what else can we be doing and should we be doing? And so really leaning in much more forward around everything from public health initiatives like WASH and food security, disease detection, and prevention, all the way through healthcare delivery and R&D. And we did that by design. So in May of this year, we launched our Health and Prosperity Initiative, which is committing DFC, to spend up to $2 billion on global health initiatives around the world. And it's been really incredible. Since May, we've had about 400 plus inquiries. And those inquiries and proposals that we have in the door have spanned across, pharmaceutical supply chain. So that means pharma manufacturing, fill and finish, cold storage, last mile delivery. And it's been incredible to see the type of innovation occur as well. I would say the other sort of piece for us, as we're talking about economic recovery, our agency is really balancing our portfolio around how do we support our current clientele, so ensuring that they have the liquidity they need to continue to run operations. How do we support economic recovery around the world? And third, of course, and why we're here today, is what is it that DFC can do to really lean forward around health system resiliency and global health security as well.
Oh, that's really exciting, and I'm sure. I could be wrong, but I'm sure that many of the hundreds of people who are listening to us aren't really aware of DFC's Health and Prosperity Initiative. And so I'm glad that you were able to tell them that. Also, it sounds, and I believe, or you could say a little bit more about how the mechanism works, but I believe that in addition to the capital that you can infuse into these efforts between the U.S. and Africa, it also is a way of catalyzing further investment from the private sector itself, so that more can be done on the continent.
That's exactly right. So, a $2 billion investment from DFC could, ultimately put on an additional $3 billion, so that could look at, $5 billion worth of investments around the world, which again is pretty impressive. I would say even more so, the opportunity for DFC to work with our sister agency, USAID, has really helped us to, again, look at opportunities that we may not normally be able to finance because of the risk engaged with some of these types of transactions. But being able to work with our partner at USAID on potential opportunities for blended finance, I think, has also been an incredible opportunity over the last few months to really, again, think, strategically about the way in which DFC can work with other partners to stretch the dollar further.
And also, could just one other follow-up. Can you just talk for a moment about the partnerships you have on the continent as you're beginning to develop these investments?
Sure. I mean, I think that a couple of things. One is, I will say that, as DFC is a part of the United States government, we work very closely with the AU CDC, and we work with the HHS and Centers for Disease Control here in the States. And then overseas, obviously, we have the opportunity to work with other development very, very closely. We have about 5 African investment officers that we have placed on the continent to really spur business development in this space, specifically with health as a priority sector. We work very closely with our Prosper Africa folks as well, and our colleagues there. And it's been, I think, an opportunity for us to really think about ways in which we can partner with other, large-scale institutions, including, private sector areas in pharma and manufacturing and other areas too.
Well, that's great. I'm sure many of our listeners will be interested in finding out more about all of those initiatives. Let's stay with finance for a moment, and let me turn to Lauren Hendricks and just ask you. We've been, Nafisa has been talking about high finance, if you will, to use the phrase colloquially, And Toka Zili and the deputy minister also talked about the economic recovery plans and the way in which UNECA is helping countries to think about the kinds of investments they might want to make, for instance, in digital health, which we'll get to in a minute. But one of the points that came up a few minutes ago was about the informal economies in many African countries. I mean, it was the minister who mentioned that about South Africa. But I think that, and one of the consequences of informal economies is that it's some of the formal programs that are out there may not always reach the people who need the help the most. And I know that you've done a lot of work, at the Grameen Foundation before you went to the Equity Bank Foundation. Tell us a little bit about how these issues look from your perspective as somebody who's worked on financial inclusion, often with informal workforces who in some countries in Africa are really an economic force, that the economy wouldn't operate without the informal workforce. But often they get left behind when we're thinking about how to respond to challenges like COVID-19.
Yeah, thanks, Jeff. Appreciate it. And I think following the FISA is the perfect spot for me because it's often the high finance that makes some of the on-the-ground finance that groups like Equity do possible. I mean, and you're correct, the vast majority of workers in most African countries are employed through the informal sector. And so making sure that economic recovery is focused on ensuring that they are reached through the process is really important. I think one of the things that Equity Group has done is ensured that as we think about the economic recovery and the impacts of COVID, we're ensuring that we have financial mechanisms in place that are going to allow us to continue to be active in the informal sector. Equity itself comes out of local housing cooperative movements in East Africa. So it's always been an on-the-ground financial institution. And so over 80% of our clients are micro, small, medium enterprises. And so it's important for us to ensure that as we're kind of thinking through solutions, that we are thinking through solutions that reach that group. And so we have worked with a lot of the large development banks to ensure that we have mechanisms in place that have allowed us to offer 4-year loan moratoriums to all of our clients, ensuring that small and medium enterprises are able to take the working capital they have and invest that in keeping their business going, keeping their employees employed, and ensuring that as the recovery starts to take off, that their business still exists. We've also worked with those development banks to ensure that we had the liquidity to continue to invest in those sectors as the recovery goes on. So we are very actively planning on continuing to invest, particularly in the agriculture and the MSME sectors. Agriculture is so important. The vast majority of the informal sector is engaged in agricultural activities, so it's very important for employment and household income. It's also important for food security. This pandemic has been going on so long, we forget that East Africa was suffering from a locust infestation prior to it. So agriculture in East Africa was already on its heels before the pandemic started. The closures that Dr. Fahala was talking about, and the constraints on labor and on travel and on exports really impacted the agricultural sector. So investing heavily in the agricultural sector to make sure that it's able to produce, to ensure regional food security is critically important. So that's something that as a financial institution, Equity is really making sure that we're focused on. But we're also working closely with national government response to ensure that some of the health response is there as well. I think, the interesting role that finance can play is that it opens up and it kind of unlocks challenges in value chains and ecosystems. So, one of the things that we saw early in the pandemic, and, I sort of sit in an interesting position because I lead the foundation for the bank. So as we're looking at potential kind of charitable or fundraising activities, but we also work through the infrastructure of the bank itself. When the pandemic first hit, we really went out looking to some of our traditional partners and government partners, looking for PPE. And it became very clear very early that there was going to be very little assistance for African countries on the PPE front, as developed countries were kind of scrambling for their own PPE. And so one of the things Equity was able to do was work with the Kenya Manufacturing Association, KEMSA, and with the government to provide financing to Kenyan manufacturers to produce PPE locally. And as a result of that, Kenya is now self-sufficient in PPE production and is looking to start exporting regionally to Rwanda and other countries some of those PPE resources. So, and I think this is a kind of a lesson, Dr. Fallow, you were talking about, some of the things we should learn going forward and put in place maybe before the next pandemic, which is how African countries can be more self-sufficient in some of these resources for some of these this probably isn't the last global pandemic we'll have. So how can African countries prepare to be more self-sufficient for the next pandemic? And I'll leave it at that, and we can.
Okay. Well, those are some terrific examples, and I think that what we've heard so far from each of you is encouraging, because it shows the way that people have responded with flexibility, a collaborative spirit, and have been willing to try new things from government and the private sector alike over the past 9 to 10 months. I'd like to turn now to first to Dr. Sahili and then to Dr. Papa Salif Sow to just ask a question from a slightly different angle about, we've heard from our previous speakers how governments and financial institutions have been responding to the needs during the pandemic as we think about academic and social recovery. Let's talk now from your perspective at a major hospital in Zambia and a major biopharmaceutical company that has been very active on the African continent. What are some of the ways that you're seeing governments working with the private sector to build capacity to respond to future outbreaks, to deliver basic services now? Dr. Sahili, you might want to start, and also Thokozile talked about the importance of digital transformation and digital health at a time like this. That may be something that you're seeing in your own work at Medlin Health Services. So let's turn to you first, and then to Papa Salif Sow.
Thank you, Jeff. Yes, I do agree that it is time for the private sector to come in with a new vision, a new way of dealing with healthcare for the future, and to be able to welcome any new pandemic without having to go abroad and outside the continent, but to rely on our resources. And one of the forgotten resources in Africa is the manpower. If we work on really transferring the skills to the people living in Africa, then I think we can really make use of them, give opportunity to the youth, to also the women. I think the young population has the right also to play a role, and it is fortunate that this is the category of people who are in a tight relationship with the digitization, which is very much needed. We have seen in our practice that we had to go into virtual assistance in terms of some consultation, some follow-up of intensive care cases, and that was not easy, and I don't think it's easy for facilities who are not already prepared for that. That is not easy for people who are not working on empowering the staff that they do have. On the other hand, this new technology also can be used and utilized in the local manufacturing. We don't have to only manufacture what we eat or the basics of what we need. We have seen a lot of bottling companies who shifted their bottling activity into manufacturing of hand gels and sanitizers, which means that when the will is there, I think we can really make use of the skills of the people. And one of the things that government should work in hand in hand with the private sector is giving those incentives to private sector to go abroad the cities and to literally invade the rural areas, but invade positively, so that we can offer those services to the rural areas. Because we have heard from Tokoziri and even from Dr. Faala and from John from CDC, yes, the vaccine will be available, and our colleague from Gavi has mentioned that. But it is our responsibility to ensure that locally we can spread that vaccine presence across the country. So it's not only a matter of having the vaccine available in the city, but also taking that into rural areas. So logistics is a major component. And just if I can end, because Lauren has mentioned one of the major sectors that we have to focus on. With this initiative that is launched by CCA, we're talking about health security and resilience, and food security is a major pillar, because UHC is not only about financing directly healthcare sector, but it's also about ensuring that we all have access to clean and clear water, to food resources, etc. And that doesn't come within just one initiative. We have to support all those sectors if we really care about UHC. We have to support the local manufacturing if we really care about the Africa Medicines Agency. Otherwise, I mean, how do we do and work in local manufacturing if we don't have the team, if we don't have the technology, and if we don't have the support from governments who have to make sure that incentives are there, and not only in paperwork, but concretely there to attract investors to come in. So I think we have a role to play, and I think we have to think beyond COVID-19. COVID-19, in my opinion, is now past. We have to guide and to help in promoting leadership for the future, taking lessons from what has happened, how we face that, and move forward. Thank you.
Well, thanks, Mo, for those insights. You made me think of three things. One is that what Dr. Nkengasong said, that everything is more connected and people are more vulnerable than we realized before the COVID-19 pandemic. And, mentioning food security and the need for clean water, those are examples of how the entire environment around communities has an impact on how healthy they can be. And so we need solutions that are holistic and that take advantage of insights based on all of the social determinants of health as well as healthcare per se. So it's particularly interesting to hear that come from somebody who runs a health system, because it shows that you're thinking holistically, and I think that's going to be good. And also you reinforce some of the things that we've heard from the previous speakers about how government is trying to help, because you've outlined several areas for investment where both micro investments of the kind that that equity can make, as well as large investments of the kind that that DFC can make, will help to find solutions to some of the challenges that you mentioned. Now, Papa Salif Sow has also been involved in these issues for many years. And how does it look from your perspective, working at a pharmaceutical firm, trying to contribute to sustainable solutions for these challenges? Salif, go ahead. Salif, go ahead.
Yes, I'm talking. Thank you so much, Jeff. I want first to say thank you to the Corporate Council on Africa for having me here. It is a pleasure to join such an inspiring group of global leaders, and I'm honored to be part of the launch of the CCA Africa Health Security and Resilience Initiative. And on behalf of Gilead Sciences, we are very happy to partner with Africa Leadership and the partners here today to strengthen and support Africa health systems, and so that a healthier future is enriched for the people of Africa. So to respond to your question, Jeff, I just would like, representing here Gilead Sciences, which is a biopharma company with a solid expertise on viral diseases, including emerging infectious diseases like COVID, I just would like to give some 3 concrete examples from Gilead. One of the best examples from my work with Gilead is our partnership with the Bill and Melinda Gates Foundation COVID-19 Therapeutic Accelerator. And this initiative is helping coordinate all COVID-related to research and development and scale up effective intervention that can prevent or to treat mild or moderate form of the COVID-19. And for example, in May of this year, Gilead has signed non-exclusive voluntary licensing agreements with generic pharmaceutical manufacturers in Egypt, in India, in Pakistan, to further expand supply of remdesivir. And this agreement allows 10 generic companies to manufacture remdesivir for distribution in 127 countries, including all African countries. So I think this is a very significant effort for us to be sure our products are accessible and affordable for everybody, regardless of your socioeconomic status, developed or developing countries. And the other example is the regional lab supported by Gilead Sciences through a grant in Dakar, Senegal. This is the regional lab, and it was built in before COVID-19. And this is a center of excellence for WHO, for Africa CDC, for ADTCTP. And during COVID, this was a very wonderful opportunity to bring lab technicians from all West African countries, Francophone or Anglophone, to be trained on how to manage COVID-19 testing. And this was a very good example from Gilead collaborating with Africa countries and to strengthen the South-South collaboration. And I think this is very important for the private sector to be involved in responding to COVID-19, supporting countries in Africa. In parallel, we also continue to invest in the public-private partnership that we know is work very well. And just to conclude, Jeff, finally, all effort must be integrated into local input and have local sustainable management. This is how we work with government in Africa and trying to, to be sure that this help ensure resources are well directed and culturally relevant to the different countries. So thank you, Jeff, for giving me the floor. We can hear you, Jeff.
Jeff, you're muted.
Sorry about that. A typical online conference occurrence that I didn't realize I was on mute. Now, what I was going to say in follow-up is, it's you have a distinguished reputation as an HIV researcher for many years, and while you were based in Africa, you also established some truly international networks for collaboration in HIV. And I wonder, just thinking of where we are in the HIV epidemic, that over 30 years, close to 40 years actually, we've actually turned it from a disease that there were no answers for to a disease now that you can live a long and healthy life as long as you get treatment and maintain that treatment. So we're at an early stage of the COVID-19 evolution, but where do you think that kind of collaboration and building those sorts of international networks comes in by analogy with what's happening in COVID?
Yes, thank you very much, Jeff. I think this is one of lessons learned from this COVID-19. And as the minister said, because of the lockdown, because of the travel restriction, COVID-19 had a very significant impact in other diseases like HIV. People was not able to go for consultation. And a recent report from the Global Fund, highlighted the very negative impact in terms of morbidity and mortality for HIV positive patients, as well as for TB, malaria, immunization programs, all these things. So I think we need to learn from this pandemic and trying to ensure the continuity of care for non-COVID patients. And this is very, very important. I think we already heard telehealth, telemedicine, how we can use this new technology to ensure the continuity of care. And of course, COVID is very different from HIV, but we can learn also because with the COVID research and development for vaccine, there was a wonderful science behind this research. That's why in less than 9 months, we were able to manufacture a very productive COVID-19 vaccine. And I do believe we will learn using this research platform to apply this research platform to other diseases like HIV. Why not learning from there and to develop very soon an HIV vaccine?
Oh, well, that's something that's been desired for dozens of years. So that would certainly be an interesting outcome in another area. But I think the point you made about the need to ensure continuity of care in other conditions, even while the health system is grappling with the emergency of COVID-19, is critically important. And just a follow-up to Mo, are you seeing that at Medlin? Are you seeing an impact on care in other areas because of the intense attention that's required for COVID right now?
I think that we have to focus on the other areas, especially the non-communicable diseases that were for a long period of time forgotten, at least in our region. I think our focus was really on diseases such as malaria, HIV, and we've done a great job. I'm not saying no, but we have seen that COVID-19 has hit us in areas where we were not focused, such as the non-communicable diseases, and the comorbidities are behind the mortality rates that are different from one country to another. So that also relates not only to our daily practice in healthcare facilities, but also to the education and the raise of awareness among the general population, the lifestyle that we are having, and how to really confront those non-communicable diseases. And this is what will help us in the for example, the telemedicine that we are talking about. This is where we can spread the information through educating the patients who are at high risk, not the patients who are already diagnosed with non-communicable diseases. It is very important that we start that communication with people. And honestly, it is time to talk about diabetes, about heart failures, about hypertension, and to stop those words of, for example, my relative has died of BP. BP doesn't kill if we know how to manage that and if we know how to take care of that. I think COVID-19 is also a way to re-educate us on how to focus on the lifestyle and the healthy lifestyle of a person, regardless of if this is in line with the long-term policies that we have put in place that have helped us again in fighting malaria, HIV. But we have to say it loud, we have failed in some non-communicable diseases, and that's why today we are facing those comorbidities, and it's time to fight them.
Yeah, no, I completely agree, and you know, you remind me of an old cliche that has a lot of truth to it, that an ounce of prevention is worth a pound of cure, and so you know that really is something that's true all over the world. Now, I'd like to just remind everybody listening to us that we'll be turning to questions from the audience in a few minutes. And you can type your questions into the comment box, and they'll reach me, and I'll share them with the panel. We have a couple of questions in the queue already. But let me turn back to our panel, and I have a question for everybody. This is a very multi-sectoral group. We have the Ministry of Health of South Africa, we have UNECA, we've got a private bank, we have a development finance bank, and then two different parts of the health sector. And one of the things that's come out of our discussion, and also from what Caroline Rohn and Dr. Nkengasong and Ngozi Okonjo-Iweala said, is that we're going to need more multi-sectoral partnerships to really see our way through the COVID pandemic, and then to build back better, as a couple of you have mentioned, for future health challenges. So I wanted to just ask each of you to briefly intervene on the question of, if we need more multi-sectoral partnerships to address both global health security and universal health coverage, which Tedros has often observed are two sides of the same coin, what are the barriers to creating those partnerships? Or conversely, what are incentives that can help to create more public-private multi-sectoral partnerships? So, and just, this doesn't require a lengthy answer. It's just one or two barriers or enablers that can help us think about this more cohesively. Mo, go ahead.
Yes, I would say that the barrier and the enablers are somehow related. It is time to sit together. We have seen that, for example, in times of crisis, Gavi, CEPI, WHO had to come together in order to form that COVAX, so that we can ensure that everyone has access to the vaccine, for example. It is time that in times of no crisis, that we sit together transparently, public and private sector. For instance, if today Medland would like to become a teaching hospital and would like to have an agreement with a university in South Africa, the barriers is that we did not talk together to see how we can really make it happen by adopting our curriculum as a continent. The barriers are that we are stuck in paperwork, and we are inviting investors to come and invest in pharmaceutical industry, while we know that we have a lot of regulations that need to be updated so that we can welcome the investors. So I think the barrier is that we don't sit together transparently, and the enabler is that we need that will, and to concretely sit and discuss without blaming anyone, but with saying these are the challenges that we have to overcome in times of no crisis, not only in times of crisis.
That's important. Anyone else have an idea or an example? Oh, you're on mute, Salif.
No, it is from the, yeah, is it working?
Yes.
Yes. I think first corporations must commit to strengthening initiative we know work in the African countries. This means applying research-based intervention and targeting them so that essential care reaches population with the greatest need. And second, African government and the private sector must explore new ways of working together, both inside and outside of the healthcare sector. For example, how can we incorporate new technology and new types of financing into our health program to reach more people? I think these are some examples that we must apply for better improve the collaboration between the private sector and our African government in the continent.
Oh, those are both two good examples. Nafisa, and then the Deputy Minister next.
So I don't have anything that's necessarily groundbreaking, but I do think that there are times where, institutions become very complacent with the way in which they do work, and this is the opportunity for us to break that barrier. And it's hard, right? Because it's easier to sort of go alone at these things. But if we're going to actually make progress, we're going to have to double down it and actually work together. And I think that I think part of the challenge that I've seen, and I'm hoping that at least DFC, I can do my part and hope that we do that across the agency, is really start to operationalize the discussions that we're having, right? It's lovely to have these conversations around harmonization of regulatory barriers, but like what does that actually mean, and what are we going to do about it? And so figuring out ways for us to put our money where our mouth is and operationalize some of these challenges that we're seeing and say, okay, well, this is how we're going to tackle this. And being strategic about it, right? There's a role that all of us play in this, if we're talking about any one of these things, whether we're talking about pharmaceutical supply chain or, pathogen genomics and thinking about disease, surveillance and detection, there's a role that each of us plays. And so really starting to map that out and again, sort of saying, here's where I'm going to prioritize my efforts and time. But that to me seems like a natural step. And again, nothing groundbreaking, but
yeah, well, I think those kinds of very practical insights are important in building the partnerships that we'd like to see more of. Minister Fahala.
Well, thank you very much. Thanks to the other colleagues. I think just to share with you just a small experience from our side. As South Africa, we have a very powerful private health providers, private hospital groups, some of them on the stock market, very strong financially. Now, it's been very difficult over time to really find each other between the public health and the private providers, with sometimes very high suspicions, very strongly entrenched interests. But what we found out during the COVID was, we're forced to find common ground, in the sense that as the lockdowns, the fear of going to health facilities, you found a situation where the private providers were under a lot of stress in terms of, very few patients, admissions, bed occupancy dropping drastically, surgical procedures having to be postponed. People just sometimes, the doctors, but also just the patients, very wary about going to hospital. And we had to find, and on the other hand, the public sector was overwhelmed. Big numbers, admissions, ICU, everything. And we had to start talking. And negotiating and agreeing on some kind of ways in which that spare capacity in the private health facilities could then be used for public patients. We got a bit of progress in that regard, but we think it has laid a foundation for our aspirations for a future universal health coverage, where all South Africans will have a common pool of coverage. And we think just that experience has laid some foundation through which we can build on for future collaboration. So it was quite a good experience, I think, for both sides, the private providers and the government.
Thank you. That is such an important insight. It sounds so simple, but it's still profound that you had to find common ground. That's often really the beginning of a successful partnership. Lauren, I saw your hand up.
Yeah, thanks. I wanted to make 2 points. One, kind of circling back to what Nafisa was saying a bit earlier and talking about blended finance, and that point about kind of everybody sitting down, all the players sitting down, and I think understanding which parts of the solutions can be commercially financed and which parts need some, concessional or grant financing, and putting those things together in a very thoughtful way. Often those 2 kind of sides of the coin don't speak to each other very well, and therefore it's hard to knit together a continuous solution that blends those 2 things well. So I think a real focus on blended finance as part of the solution is really critical. And another thing, which is much more technical, but I think we've all talked a lot about the benefits of telehealth, telemedicine. I know for us as a foundation, we're really thinking about how we switch a lot of what we do training-wise and capacity building-wise from in-person or classroom to digital. And I think while that's so exciting and there's so many opportunities in all of that, we also have to realize who gets left out when we switch to digital. And it will be the poorest, it will be women, it will be rural communities, it will be the elderly. And so how do we ensure that those people have access to the same technology that's needed as more and more things move digital? So I think those are the 2 points I wanted to make.
Well, those are both important points. And I think, a couple of you have mentioned earlier this thinking about who gets left out. And that's something we should always keep in mind. Thokozile, you, if you'd like to comment, you'll have the last word on this.
Yes, Jeff, I would like to come in and probably speak to the point that Papa did talk to, the coming together. The coming together amongst the governments and across sectors and ensuring that there is transparency. I think that is so key. The transparency allows to understand the situation on the ground and across the continent. Then it means the ability to support and be able to have a coordinated and coherent programs across the different countries. And if you look at what the response to the vaccines is going to be, if there is no coming together and a transparency that allows to understand the situation on the ground, it will be very difficult. So I think that is critical.
Yeah, no, that's an absolutely critical point. And now that you mentioned the vaccines, I wanted to just open this now to some of the questions we're getting from the audience, and that's the first one that we got. Yesterday, as Caroline Rohn mentioned earlier, yesterday was the first day that the Pfizer vaccines began to be distributed across the United States, and the first people were vaccinated. So one of the questions from the audience is, what is the plan to get the COVID-19 vaccines to Africa earlier than next summer, or as soon as possible, I think. So I'm not sure who's the right person to respond, but I'm sure that some of you are involved in those efforts and you might have a point of view on that. So who would like to take that up? Okay, Salif, go ahead.
Thank you, Jeff. Here I'm speaking as an infectious disease physician from Africa, not talking on behalf of Gilead, because I'm from Senegal, and I was the head of the Department of Infectious Disease for more than 15 years, and very involved on global health and global health diplomacy, and very involved also on the COVAX initiative. As you know, the COVAX initiative, as it was said earlier, is a global initiative for helping African countries, resource-limiting setting, to have access to the vaccine. So I think we need to be very to thank this initiative, because our country, our people in Africa will be able to have access to the vaccine. But we need also to be very realistic. This is an international competition. The vaccine are produced and will be distributed country after country. And we do believe with this global effort, COVAX and the African Union, we might be able to start vaccinating African people maybe in June or July. This is the timeline, because it is very highly competitive. The production need to be done months after months, and also we all know that we need to vaccine everybody. And I think, to be really realistic, June or July, maybe during summer, might be the best time for African countries. But it's not something very easy.
Okay, and of course, you certainly are probably as well informed as any of us on what's likely to happen. And of course, this is a moving target, so to speak, that, more manufacturers will be brought into the process over the coming months. More vaccines will be approved and available, because there are over 100 in development and several are in phase 3 trials. So that means we'll see how the trials turn out and when new vaccines come online. So there are a number of factors that will make that possible. At the same time, it gives African countries a chance to prepare to do the public health communications that are required, to work on the infrastructure for supply chains, and to find ways to develop the partnerships, because it's going to require a public-private partnership to do this. I mean, just for an example, in the United States, many of you will have been following this, but the government, through Operation Warp Speed, has been underwriting some of the distribution and they're working with UPS and FedEx, two private sector third-party logistics companies, to get the supplies broadly distributed throughout the states. So that's an example of how this is going to require multi-sectoral partnership to get it done.
Jeff, just to add the three things, you're right. This will give us the time to, to be ready in terms of logistics, because this will be very heavy logistics. Second, communication, how to educate our population to understand the importance to be vaccinated. We need to have the maximum 70 to 80% of our population to be vaccinated. This is also very important. And to translate, into our local language, so people can understand why it is important to be vaccinated. And it is up to ministers of health and government to right now to prepare a national plan for distribution from capital city until the rural area. So I think the work is very, very important right now to take the time while we are waiting to receive the first dose, maybe in June or July, to be ready and to develop all these communication strategies.
Yeah, no, that's an important point. A related question from one of our listeners, Rich of Developing Radio Partners, asks, do you feel there's efficient behavior change communication on health issues and accurate access to accurate information so that people can accept and engage with a COVID vaccine, and also with therapeutic opportunities for other comorbidities throughout sub-Saharan Africa, and what more can be done? I mean, Mo or Saleh, if you might want to comment. Mo, why don't you start?
Jeff, I just wanted to say that this proves the importance also of engaging other sectors such as the media sector. We have to take advantage of the time that is now being available until the vaccine is available in the market, and we have to train our media colleagues, whether they are social media colleagues or the broadcasting colleagues or whoever works in media and whoever can send a message to the general population, whether in rural or non-rural areas. It is important to share with them, again, with transparency, what is COVID-19, what is the vaccine about, why do we have to take the vaccine, what are the benefits, what are the disadvantages. Talking about the negative sides is not bad at all. At least we will not leave any room for doubt, because that doubt that we are leaving is being misused on social media. And we know that today some social platforms are the best tool to send a message, especially among the general and the poor population. They enjoy watching those short videos, memes, and this is how we can pass the message. It is important to engage our media players. And just to a quick comment about what Lauren says, when we are using the telemedicine and telehealth, if we engage also with our colleagues from the energy sector, for example, in going and investing in energy-powered rural clinics, then telemedicine and telehealth will not leave any poor population behind. This is why it's also important to have a vision for the future, a strategy, and to know how to engage each sector in which area so that we don't leave those people behind. Thank you.
Yeah, those are good points. I just, one other question that we have related back to the African Medical Supplies platform, and this might be more detailed than you would want to take on, but a basic question was, who's managing the AMSP, and are African ministries of health utilizing this? I wonder if either Thokozile or Minister Fahala might have some insights on this, either from the South African experience or more broadly.
I can respond to that, Jeff, and then the minister can come in, and probably just to explain that the Africa Medical Supplies platform is a digital platform. It is a consolidated online marketplace which facilitates the provision of COVID-19 related medical supplies. It actually provides the medical supplies at a lesser price than if the governments get them in the open market. And some countries have actually been accessing them. And I see the question says, are the ministers of health aware of the AMSP? They are. This is an initiative that was started by the the special envoy, who was nominated by the current chair of the African Union, the president of South Africa, from the private sector to facilitate and ensure that governments do have a marketplace where they can access accessible COVID-19 products, PPEs, and all the other related products. Some countries have accessed them. And there's been sharing of information through regular meetings and workshops with ministers of health and other sectoral ministries. And I'm aware that the Minister of Health for South Africa is aware of this platform, and it is being utilized on the continent. It's accessible on the web, and we do provide the materials and the information to governments on how to access the platform. Thank you.
No, thanks for that information. And Minister Fala, do you have any comment on how South Africa has interacted with the AMSB?
Well, thank you very much. Indeed, as just to add what my sister there, Thokozile, said, that there has been a lot of progress in terms of pooling our resources as the continent, led by our president, who's the current AU chairman. Including not only on pharmaceuticals, not limited to COVID, but also, I must add, also on the earlier question on the vaccine as well, that this effort is also attempting to pull together Africa so that at the end, no country should be left behind. And we are quite optimistic that this will be improved going forward, will grow more stronger, and we are hopeful that it will not be until June that Africa will start having access to the vaccines. We're hoping that with these efforts of pulling the continent together, we will be, our voice will be much louder together, whether in COVAX or in terms of in negotiations with individual manufacturers and suppliers. That's what we are hoping for, and it will be quite a travesty if others are already accessing vaccines in December, and if Africa only starts to have access in June. We are hoping much quicker, and we believe that with these collaborative efforts, we will have a much louder voice and much powerful negotiating capacity. Thank you.
Well, I think we can all agree with you on both of those points. There's one other comment from the audience I just wanted to share from the U.S. Pharmacopoeia. As African countries prepare for COVID-19 vaccines, it's equally important to support national medicines regulatory authorities to be well prepared to fast-track local approval. So it's an important point about how regulation actually works. And I know that the African CDC and the new African Medicines Agency will be coordinating across the continent on that issue. So thanks to the USP for bringing that up. Well, we're running out of time, unfortunately, because I know we could continue for some time. This has been a really fascinating and informative discussion. I wanted to just ask each of you to respond to one last question, and that is, based on what we've been discussing and the challenges in front of Africa, what gives you hope for health security and resilience in 2021? So we could just start if anybody would like to jump in, go ahead. Otherwise, we'll start with the minister.
Well, to me, what gives me hope is the fact that I think the pandemic has brought us together because for the first time, unlike Ebola, unlike many other, health emergencies, this is not a health emergency which affects one country, one subcontinent, one continent. Is across the globe. So what gives me hope is that there will be a much more collaborative spirit, and that's why as South Africa, we have never been hesitant in supporting the work of the World Health Organization. We believe that if all of us rally around in a collaborative way, and we believe that the foundation for that has been laid, and there are prospects for the world to come together in terms of dealing with world emergencies and pandemics. So to me, there's a hope that 2021 should bring us much more closer as a globe. Thank you.
Well, thank you. And let's go to Chakazili. Why don't you tell us what gives you hope?
What gives me hope, Jeff, is the learning of lessons from the previous epidemics like Ebola and SARS and HIV on this continent, and the way the continent has responded as one, which has not always been the case, but they responded collectively. That gives me hope, and I hope the collectivity will continue as they respond to ensuring that the continent has vaccines.
Thank you. That's also a really important point. Nafisa, how about you?
Sure. I genuinely believe that crisis brings opportunities for transformation around the way in which we traditionally approach things. And I think that the pandemic has shown that there are new and innovative ways for us to collaborate and to partner and to work together. And so, I think that if anything, we're going to see leapfrog innovation in this space, and for me that is incredibly hopeful. And again, I think we're going to see new partnerships, new opportunities to build strengthen supply chain across the world. And as others have said, this has been an opportunity, I think, for the entire world to see we have to come together to work on this. It can't be something that is done in a silo. We have to come together. So that gives me a lot of hope.
Terrific. Lauren, how about you?
Yeah, absolutely. I think, there's a couple things. I mean, one, coming from a country who's maybe got some lessons learned on how to respond in a pandemic, seeing how successful so many African countries have been in really coming together with a very strong response and having very positive outcomes from that has been super inspiring. But I think the other thing, more with my work hat on, is seeing how traditional rivals have come together, seeing how business leaders, in Kenya, for example, Equity Bank and KCB and Safaricom, who are all fierce rivals in the marketplace, have really come together to develop kind of joint strategies around COVID response. And so seeing how private sector can come together for the purpose of, ensuring that the continent can recover, and how private sector has worked so positively with governments across the region, to me has also been a really, really positive outcome of this, and one that we need to not leave in the crisis, but really take forward in the recovery.
Yeah, thank you. Thank you. And then we have Papa Salif Sow. How about your thoughts on this?
Jeff, I'm someone very positive by nature, and I think 2021 will be wonderful, better than 2020. And Mr. Minister, you're right. I'm someone who believes we might be able to have access to the vaccine as soon as possible. And this is our dream, our hope, and we can do it in collaboration between African government and the COVAX. We can do it, and we will do it. And what gives me hope is the global solidarity because of the COVID. We have seen right now a new way of collaboration, and the word of global health diplomacy is very strong right now. I think this gives me hope that we are all united, we are all in the same planet. We need global solidarity, global health diplomacy in order to be very positive. But I think we need also to learn lessons from this COVID-19. And we, as infectious disease physician, I strongly believe that this will be not the last pandemic we will face. We will face, additional pandemic that will come. But we need to learn from COVID and to be ready for the next coming. Thank you.
Thank you. And Mo, you get the last word.
Well, what gives me hope is the youth generation that are present on our continent. I think we can rely on them. It's also the fact that this pandemic has really pushed us together in one room to address the challenges so that we can overcome and bypass this crisis. I think it was the right time to teach us how to lead the technology rather than having the technology leading us. And as I said to my colleagues before the holidays, I call this year 2020, and I look forward for a healthy 21. So it's time to take advantage of what happened. That was not a trial, that was a real TV show that we all lived together. And I think that the lessons were too many. But again, as human beings, this is what we do. We just survive.
Well, thanks. Well, let me, I can hardly improve on the eloquence of our panelists, but I just wanted to conclude to make 3 points that I think we've demonstrated over the past hour and a half. First, there's, global crises require global solutions. So we've heard that from many. And we now know that there's a need for investment in resilient, equitable health systems. To achieve that, we need strong multi-sectoral partnerships. And also, we have to remember that the health sector and the economy are intertwined, and that health sector investments yield economic benefits. And conversely, investing in jobs and inclusive growth will yield improvements in health. And that's quite clear from all the things that we've heard in this conversation. So we're looking to develop those insights through the work of CCA's new U.S.-Africa Health Security and Resilience Initiative. And we'll look forward to working with you and with others who are in the audience on some of the projects that will get underway over the coming couple of years. And also we'll be providing information through the website for the initiative, and we'll be looking to partner with as many who have a common interest as possible to really improve not just the response to COVID, but as several of our panelists pointed out, this is not the last health crisis that will hit the African continent. So we want to make sure that we learn from this experience and apply those lessons to be better prepared in all the ways that we've talked about for the next challenge that comes along. Finally, I want to just say what gives me hope is that we have people who are as smart, committed, professional, and passionate about the issues as you've seen from our panelists in this morning's conversation. It's been a terrific discussion. I really want to thank all of you for your participation and for taking the time out of busy schedules to share your insights with our audience. So it's really been a pleasure, and I look forward to our next occasion to get together and share our viewpoints on these critical issues. And with that, I'd like to just hand back to Flory, who will. Thanks again.
Is that this new initiative, our U.S.-Africa Health Security and Resilience Initiative, can make a difference for governments working together and collaborating, for the private sectors from both the U.S. and Africa working together and collaborating, so that all can benefit in terms of addressing not only COVID-19 and future pandemics, but also to increase the health and the security of the people across Africa. And so that is what gives me hope. We're looking forward to working with all of you. Now I have the pleasure of introducing our next speaker for closing remarks. Marianne Abo El Kair is the head of Emerging Africa at Medtronic. Marianne is responsible for making long-term strategic decisions for the emerging Africa region in alignment with the global strategy and objectives of Medtronic, which is to maximize sustainable access of eligible patients to Medtronic technology, including the right go-to-market models and the relevant partnerships with various governments and stakeholders. Marianne brings to Medtronic more than 20 years of business experience across various industries, automotive, electromechanical, and pharmaceuticals, and within various functions, such as finance, operations, sales, and marketing. For the last 10 years, Marianne has been a member of the board of directors with Janssen Pharmaceuticals, a company of Johnson & Johnson. And with that, Marianne, I hand it over to you.
Thank you, Flori, for the introduction. Good afternoon, ladies and gentlemen. I would like to start off by thanking our great panelists and speakers for the fantastic, engaging discussion, and the Corporate Council on Africa for organizing such a great virtual launch of the US Africa Health, Security and Resilience Initiative. As Medtronic, the world's leading medical technology company, we are also the largest global manufacturer of devices for the full spectrum of respiratory illnesses that are needed to treat patients suffering from COVID-19. As Medtronic, we strongly believe in expanding access to medical technology and to improving the health of patients and strengthening the health systems throughout the world, and particularly in Africa. With strong, sustainable African health systems, we can also address one key challenge that is facing our continent, which is medical tourism. As we Medtronic consider it's our duty that all African patients and their families are to be treated in their home countries and within their home communities. That is why we are particularly excited for the launch of the CCA's US Africa Health, Security and Resilience Initiative. And in fact, this initiative is designed to have a coordinated approach to addressing health security in Africa by leveraging the strength of governments, the multilateral institutions, and the business leaders in the US and across Africa. As we have seen in today's discussions, Africa has an impressive story to tell of innovation and leadership in the face of COVID-19. On the path to resilient health systems that can withstand health threats such as COVID-19, we must continue to build on the innovation and the innovative solutions and collaborations that have emerged in response to that pandemic. Through this initiative, CCA and its members aim to boost global health security by improving health infrastructure in the region, by also enhancing communities' access to basic and affordable health care, and strengthening capacity of healthcare supply chain. As Medtronic, for more than 70 years, we have been committed to improving clinical outcomes, expanding access, and optimizing cost and efficiency, which are clearly fundamental to all healthcare systems around the world. We believe very strongly as well in the underlying principles behind universal healthcare. In collaborating with the private and public sector, with the multilateral organizations and other key stakeholders, Medtronic firmly believes in public-private partnerships to create new solutions, advancing health services, and transforming the healthcare in Africa. I would like to thank CCA once again for its work promoting trade and investment across industries between the US and Africa. On behalf of Medtronic, we're delighted for your participation and to be part of this event. Look forward to an impactful US-Africa Health, Security and Resilience Initiative. I hope you all have a great rest of the week and happy holidays.